And I've had PTSD, so I've learned to do more and more things to make myself comfortable. So that's why I let the blanket come up here. One moment, please. Yeah. Just a lot of feeling. I've been looking forward to being here today for quite some time. And not in the same way I would say that I've spoken in other places or even spoken in front of television cameras. There's been something very, very special about Iceland for me. This is my 4th time here, and yeah, I've just had major transformations here. None to do with psychedelics, but just the power that's in this land and the people here. It's touching every single time. So, yeah, I've been thinking a lot about what to say today, and really for months literally just like imagining myself sitting in front of you here. And certainly in the last week, I've just been toiling different versions of the talk and what do I want to say and don't forget this. And then last night, I just threw everything away. I was so stressed out. And I'm like, that's not your thing. You speak from here. Let's trust that. So, the reason I chose the title Sagas and Psychedelics, and for those who are not Icelandic, there's the Icelandic sagas, which I won't even pretend to know at any depth, but I think all the children in school learn about them here. They read about them. It's 9th, 10th, I think 11th century history of Iceland, and it just reminded me of just the importance of stories and the importance of our history, and the important lessons, and they're not just stories of happy endings of Disney. It's struggle, and it's triumph, and it's working together, and it's deceit, and it's stealing, and it's all of it, And so to me, the most important, and maybe maybe I'll step back and say, hopefully by the end of this talk, you'll understand why I was crying in the beginning of this, and you'll understand why it means so much for me to be here. Does that sound okay? I only have 3 slides and 2 of them are pictures, so I know I have an MD and a PhD, so if you were expecting more science, I'm going to disappoint you sorely. But hopefully we'll have some fun. And when I say that, I'm just so honored to be here, is that I think about the steps it took me to be here, and so I guess maybe I'm telling you a little bit about my saga today. And the first thing I want to share is this picture of me, which is one that I've thought back to many times, especially after I started my healing journey, which was about 10 years ago. And it was a critical age. I was around 6 or 7 years old here. And, I just remember finding this picture at one point. It's not one that I always had, but I remember being so happy. And I remember feeling so free. And I remember feeling so excited about life. And I thought my parents were so special. And that, my sister was the most beautiful girl. I just loved life. And then, then this is also the age where a lot of things started to happen to this boy. So I've worked a lot with him and that part of me, with and without psychedelics. And it was soon after, at this age, this is my first school picture, where I started going to school. And very early on, and I ended up looking back at my report cards that you get every quarter, every semester, and for the first 3 years, it was consistent with every teacher. It said, and my full name is Willie, so it said, Willie gets out of his seat too much, Willie is too hyper, Willie talks too much. And it was soon after getting those report cards that my father started beating me. My parents were immigrants from Central America, from Nicaragua. And that's the way their parents, discipline them. And I think of it as a time that I started to silence myself, right? I really started believing that I talked too much. I started believing that I was too hyper. I started believing that I should sit still. I shouldn't move so much. And these were the early lessons of shutting myself down. So part of why the emotion comes here sitting today is because the things I've done over the past years, especially conferences, media, has been because this coming out of this silence and learning to trust myself again, learning to trust my voice again. But that took some time. Another thing that started happening soon after that, I started getting into trouble. I started getting involved in gangs. And some of that activity ended up having threats against my life, people that would drive in front of my house with guns, other kids. This was high school now. Another set of circumstances that happened to this boy was around this age also. My mom converted to being Jehovah's Witness. I'm not sure, some of you may or may not be familiar with that religion, but it's a very, very restrictive religion. They don't believe in holidays. There's no birthdays. They believe in an end of days. The Armageddon is coming. And just real terror started entering me at that time. All the things that would take me to hell, and that were sinful. My thoughts. God, I remember when, again, this boy started puberty and started feeling sexual feelings and started masturbating. It was this time of just, again, thinking every time, this is going to take me to hell, but I enjoy this pleasure. Like it was so confusing. And so I mention that also because it's been a part of my healing journey, right? Learning to let myself have fun, to have pleasure. And I tell these stories hoping, and not even hoping, I know that parts of this story, or you have your own versions of your own sagas of how you were suppressed. Okay, whether it was religion or your parents or your culture. But I think the reason I like to share this part is because this is what the healing is about with these psychedelics. Is really taking a look at these stories for ourselves, really learning how to feel again. It's crucial. And so what happened to this boy? So I shut down, I dissociated. We use that word dissociation, but clinicians are only using that word dissociation for a very small percentage of people who are actually dissociated. One of my teachers and friends, Gabor Mate, we were talking about this topic recently, and you may have heard about him. He published a book of The Myth of Normal recently. And he and I were kind of playing with a number, and we think around 97% of people are significantly shut down from their emotions, meaning almost everybody. Okay. What clinicians, meaning therapists and psychiatrists, refer to as dissociation, again, is the worst of the worst. But I didn't even realize that I was dissociated significantly until a few years ago, and I'm a psychiatrist, so yeah. Which reminds me to say that psychedelics are representing a big change we need to implement in terms of how we look at health and mental health. And it's not just psychiatry, just the whole approach, the whole foundation of what makes us sick, why we're sick, why we're suffering, is needing to change. And we're just starting to see that. So, I heard the question just before, I came on, and I think I appreciate that, because I know you're not the only one in the room feeling that. We need real empathy, we need real feeling. And I tell my colleagues and sometimes my patients, talking about feelings, talking about empathy is not the same as embodying feelings and embodying empathy. Okay? Or I'll say reading about or writing about empathy and feelings is not the same as feeling feelings. Okay? One is the mind, one is the heart. One is the mind, one is the body. Okay? Very different. So what was the result of again, that's just three, 4 stories. If you wanted to know more about my trauma, we would need about 3 hours, but I've got plenty more that happened when I was a kid, but I'll spare you for now. So another thing that happened was that my parents were immigrants, and my mother only finished the 7th grade. And so this also had a big impact on me because I remember at one point, I always say I learned my family was poor, right? I had to learn that. Like, kids don't know that. They don't even know what that means. So I took on a story. Another one of my chapters was, I'm poor now. But I remember there was a day I learned that, which for me came with all the lessons of that. I'm less than. Or those people that live in that neighborhood, all of a sudden, were better than me, where my home was beautiful to me when I was a kid, And so these are all these little stories that we take on, and that most of us are completely unaware of. Okay? And so the result of that story was I needed to achieve to become somebody. And so the thing I did have going for me that I was pretty smart. I didn't have to study much. And so I started studying very, very hard in high school. And got into college. I was the first person in my family to go to college. And since we were poor, I thought, hey, I'll either become a doctor, a businessman, or a lawyer. I just figured 3 things that could make money. And so I chose doctor because it seemed the most empathic. And then once I got into college, I just really, really focused on studying, but I really struggled socially. I really struggled romantically because we didn't have conversations at home around relationships or sex or, Jehovah's Witnesses, you were also not allowed to hang out with other kids. So I didn't have the social skills, but then I found this place where I started feeling rewarded. Oh, I get good grades, I get awards, I get scholarships. And so I started really pasting all of my self-esteem on my accomplishments. Okay. And so after college, or in the middle of college, I decided I wanted to try to get to the best medical school I could get into, and that was UCLA. And I remember in college feeling very down, very depressed. I didn't have friends, but I'm like, if I just make it to a good medical school, I'll be happy. And that was the beginning of a pattern. And I made it to medical school. And then probably within 3 months, I was miserable again, depressed, suicidal. But then I was like, oh, no, I got it wrong. I didn't realize that, oh, no, people are getting PhDs now. Those are the best of the best doctors. Let me get a PhD. So then I applied and I got into Oxford. I spent a few years in England getting my PhD. And again, same thing. I got there. It was a few months of happiness. And again came this isn't fulfilling. Oh, no, now I have to get the best residency. Now that's the trick. And you see this. I'm sure this isn't unfamiliar with many of you. This thing outside of me is going to make me happy. And so a lot of that I'm explaining is what was happening in my mind. And this is me probably in my UCLA hat. So I was probably about 30. I'm 42 right now. And you can probably tell in this picture, I'm about 44 kilos heavier than I am right now. So one of the ways I used to cope with my emotions or not feeling my emotions was eating. I wouldn't have to feel this uncomfortable sensation in my belly because I would eat and I would eat and I would eat. Actually, I was probably 42 kilos heavier. I had quite the meals the last few days here, so I think I gained a couple. Okay. Are we doing okay? Is this interesting or fun? All right. Just I sometimes get nervous. I'm like, are these people just wanting to go eat lunch? So the thing is in this photo, I guess, that it's really painful, and it also just, to me, represents this shutting down, this hide myself. And I remember also thinking, once I was in therapy, I'm giving you reflections on this time in my life, that I was, because of the Jehovah's Witness history, because of this discomfort with sex and sexuality, like I felt that I was hiding myself under layers of weight, under layers of tissue. I did not want to seem attractive to other people. And at the same time came the guilt and the misery and the dislike of my body and the still working out. I worked out so much in this. In this photo, I remember I was probably running about 20-25 miles a week, going to the gym like every other day. I was strong, but I could not keep the weight off. And now I just like rock climb and eat whatever I want. And somehow I stay lighter. But again, back to this story of accomplishment after accomplishment after accomplishment. So after Oxford and then graduating from UCLA, so I applied. I was like, I want to be a psychiatrist. I want to become a researcher who makes new antidepressants. That's what I wanted to do. And I'll let you know that by that time I was atheist. I had left the church about 15, and I said, there's no God, there's no spirituality. It's all about science. It's all about show me the evidence. That's the only thing I'm going to trust. And so, I applied broadly, and I got into the psychiatry training program at Harvard Medical School, the top in the country. They probably like to think of themselves as the best in the world or the universe. All those rankings and things used to matter so much to me, and they mean nothing to me now. That's why I kind of laugh a little bit. So I pushed myself, of course. I got into Harvard, and one of my Harvard classmates is here. It's really, really touching that some people here are here from different parts of my life. And again, I thought I was so happy when I got there, and my white coat that said the Massachusetts General Hospital, and I was so proud. But that year almost destroyed me. My father had died about 4 years before that. Sudden illness. We weren't close. We had been up, just distant, and then he got a sudden illness, and within a year he was dead. I was living in England. But I got to Harvard, and then I was like, yes, okay, I found my people. These are the psychiatrists. They're going to understand mental health. We're going to have deep conversations about emotions. But any of you who are doctors here, you find that's not what happened. And the first year of doctor training is very challenging. Lots of nights in the hospital, lots of sleepless nights, continued hierarchies of the resident and then the faculty and then this, and it was just like never ending. And so I finished that year. I was 32 years old, and then I remember the day we had this lecture. We had just finished our first year. I was on this rotation for inpatient psychiatry. And there was one lecture that just changed the course of my life. And the professor was teaching about the STAR-D trial, which is the big trial for depression. And I remember him starting the lecture by saying something like, I'm going to show you the data for SSRIs for depression, and I'm going to show you this is the best evidence we have for any pharmacologic intervention for psychiatry. And I got very excited, and I was like, oh, cool, like we're going to learn the real stuff here. And he ended up putting up the numbers, and he ended up saying after these thousands of people, double-blind crossover, blah, 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 he's like, about 1/3 of people no longer have depression. And my heart dropped that day, really dropped. Because by then I had spent 15 years straight after high school. Straight years, no break to be where I was. And I was like, are you fucking kidding me? 15 years for 1/3 getting better. And then the kicker, the joke, it was not a joke. He ended up saying, and that's compared to placebo, which is 19%. And I think even though I've been shut down and dissociated, I was much less so than my classmates. Because I remember looking around and no one else seemed to have the terror in them that I was like, 10% then is what we're talking about. And that's when I started psychotherapy for the first time for me. I was like, I almost dropped out. I got very depressed. And by then in therapy, I had figured out this thing about the patterns and reaching again. I almost applied to business school, but I realized that's not the answer anymore. Except the very challenging part was like I didn't have another answer, right? The thing I had been trying for so long, I knew wasn't going to work anymore. And then I also started realizing that by then how I had not learned how to make friends and I did not have a community. And so I sat in this place of just feeling so alone. And I didn't know what to do. And most of you have probably heard the word synchronicity, and this is when synchronicities started happening. And you may not have noticed this, but so again, I was raised Jehovah's Witness. I was raised during the 80s war on drugs. I was terrified of drugs, especially because of the religion. So I had smoked pot like twice and like had gotten panic attacks. I did not think about taking LSD. Like that was the furthest thing from my mind. Now we're talking about 2014. But my childhood best friend since I was 9 years old was living on the other side of the country in California. And he sort of did the opposite of me, where he didn't go to school. He was a blue-collar worker. He was working in construction. And he had his physics tutor at the time introduce him, and she started getting him to smoke this thing called DMT. And so Chris and I would call each other, and he would say, you should try this thing called DMT, and send me, these Terrence McKenna videos. And I'm like, no. It was for months, and at one point I was like, I need to call his mom. Like something's wrong with him. He's becoming an addict to this thing called DMT. And then but at one point I was so depressed, I felt so hopeless. I was like, fuck it. So I flew across the country. We got all set up to do the DMT. We had another friend there. And I completely chickened out. I was too scared. So I flew back to Boston. And I felt so ashamed because I'm just like, I'm hopeless, I'm depressed. I flew across the country to do this thing. I chickened out. So I basically needed to feel even more depressed over the few months that happened after that. And then my next vacation, I took DMT, and then that was life-changing. But and I'm not going to say life-changing as in it made a lasting change, but it was enough of a taste to let me know that there was something else, there was something bigger. And again, I was atheist at the time, and 4 things came to me during that DMT experience, and that I remember. And this is 2014 now. Was that it was warm, that it had been waiting for me, that I had been there before, and that it was more real than real. For some reason, that phrase came to mind. And so I didn't know quite what those even meant. And I think it's taken me some years to even really start to really understand this DMT experience that I had. So, part of what I want to say with that is that if there is people in the audience that has not tried psychedelics, you hear all the excitement around it, but if you feel some hesitation, if you feel fear, that's okay. Like take your time. It's important for you to try this when it feels safe, when it feels good, and there's no problems with delaying. It's okay to be scared. And then the next thing I think that I'm really proud of this guy is that really starting to believe in myself, That was a difficult time. Again, I was at Harvard Medical School, and nobody was talking about psychedelics at that time. It was 2014, and actually at Harvard it was the opposite, because there was a professor there named John Halpern, who some years earlier had tried to do one study there, and it didn't end up working out, and the university president at that time decided, not the university president, sorry, the hospital president decided no more psychedelics. So it was actually a time that there was a lot against it. And so I started talking to classmates, I started talking to faculty, and the most common things that were said to me were stop talking about this, you're gonna ruin your career, you're just gonna get yourself into trouble. Again, this was long before Michael Pollan's book was written, right? Like and there was just not much public discourse on psychedelics. And here I was trying to, by then I had started looking up the old papers from the 60s and 70s. I had then, learned that there was research going on. But so even though there was the professors were saying, don't do it, there was something in me that said that I needed to stay. And then it was interesting because that same professor, that John Halpern, who I mentioned, probably very few people, if anyone, knows who that is in here, and it's not so important. But again, another synchronicity was that he happened to be in the office next door to me the entire year that this was happening. We were just placed next door to each other. And we all thought of him as like the crazy guy with like that used to work on psychedelics but didn't anymore. So then after smoking DMT, I go and I knock on his door. And I'm like, hey, John, can we talk about DMT? I smoked some. And he's like, yeah. And so we ended up talking about DMT for some weeks. And then eventually he's like, oh, you should meet my friend. He lives down the street. He does research on psychedelics. And I'm like, okay, let's go over there. And that friend ended up being Rick Doblin, who lives 2 blocks from that hospital still. And again, huge synchronicity for me because he was the first person in the field I met, and he's become such a dear mentor, such a dear friend. Has guided me through so much. And but I even remember going to Rick's house the first time, and he had this bong on his desk. Like, I went in like a shirt and a tie. I was thinking I was going to meet this like CEO of a company, and you saw Rick yesterday, even in that sweater. At least I think he ironed the sweater at least yesterday. My God. But I remember even after meeting Rick, I didn't reach back out to him for like 4 months because, in my Jehovah's Witness history, I was like, oh, this is drug paraphernalia, this bong, and I was like still scared. So again, see, you're seeing the PTSD. That's why I need my little comfort blanket here. Oh. So yeah, and then Rick, soon after that, within a month or 2 of meeting him, he ended up saying, hey, Will, we have this MAPS training. Do you want to go to it? And it was, again, another synchronicity that really things started to change for me there. I started learning that emotions weren't a bad thing, that the way we approach psychiatry has approached feelings, and I think of it just as the class of our medications, right? We have antidepressants, anti-anxiety medications, antipsychotic. What are we saying? If you feel fear, if you feel sad, if you feel anything that's not normal, we don't want to see it. Let's put it away, right? We've been a treatment approach of suppression. Let's hide it. Where psychedelics are much more about bringing things to the surface, right? They bring emotions that are uncomfortable. They bring memories that are uncomfortable so that we can deal with them, right? That's why we don't see addiction to LSD. That's why we don't see addiction to mushrooms. Because if you're feeling depressed and suicidal, you're not going to go take 5 grams of mushrooms because you're not going to feel better, right? So, because I know the medical community is starting to think about these and accept them more, but it's also being, there's some worry there. So that was what was easy for me to sort of think about in terms of addiction or not. These are not addictive, and the data shows it's not addictive. So it's not just me saying this. How are we doing on time here? Yeah, we're okay. So let me pull out my notes here, see if I said most of the things that I wanted to say. So, I talked about feelings, and now we're talking about, okay, so if we're changing the paradigm, or if I'm changing my own perception of what I feel, and I'm learning to feel again, so what do I do with that, right? Because we're in a culture that's uncomfortable with feeling, that's uncomfortable with emotion, right? Again, we're starting to talk about emotion, but feeling it is a different thing. And the thing I started realizing also is that psychiatry and psychology, especially psychiatry, was tasked with dealing with this issue of mental illness, but it was born within the problem already, right? And so psychiatry, in a way, sometimes is tricked into thinking it knows what's best, right? But again, the psychiatrists and the scientists themselves have their own histories, right? Have their own sagas of suppression that they're working through, right? So I think it's important to be. I think science is interesting. Right? It is interesting to me to see an MRI of someone on MDMA, or to hear that the amygdala is upregulated in PTSD and MDMA decreases it. But I don't know, at this point, I've been in my own therapy for thousands of hours at this point. I've seen thousands of hours of patients. It's just without psychedelics. At this point, I've spent hundreds of hours with psychedelics as a patient myself. And I've spent hundreds of hours as a practitioner with patients with psychedelics also. And I've seen magical things and magical transformations, but I've never once seen an amygdala. And I've never once seen a default mode network. and I've never once seen a dopamine level or an oxytocin level. It's not to say those things aren't real, but the reality is I don't need that, right? What I have seen is a lot of people sharing with me things that they've never shared with anybody before, things that they're ashamed of, right? Things that they feel guilt over, things that they feel that their friends or family or their lover will leave them. That I've seen, yeah, but I haven't seen an amygdala. Okay? And I've seen people crying. You know, I see people, many men of my patients cry for the first time in decades. Okay, or some women, not who've cried, but really let themselves feel the pain that they've been suffering. Okay, that I've seen. Okay, and so that's why for me again, it's like another thing about Iceland is like this stuff is coming in so fresh, so quick that I don't want this place to necessarily have. Maybe another way of saying it is perhaps you guys can learn from the mistakes that have been made in the U.S. There's already plenty of mistakes that have been made with implementing psychedelics, okay? And hopefully some of those can be avoided here. You know, and a part of me, I've told Rick about this, he doesn't seem as worried about it with me, but a part of me worries that, you know, we had the war on drugs, which was you know, the government and law restricting psychedelic use. And I've had this thought that came to me some months ago that I hope that the medicalization of psychedelics doesn't become the war on drugs 2.0. You see, that the doctors and the therapists believe that they must become the gatekeepers to these medicines. That would be a mistake. Okay? And again, it's not, and I'm not being anti-science. I want to be careful with that. You know, I'm just saying, and I just know my own field. I know doctors, and we love to be the ones that come listen to me. I'm the one that knows how to heal you. Like I see it everywhere. And again, we just need freedom to use these tools. We all have the freedom to explore our consciousness. Okay. Just a few minutes here. I do want to allow time for questions. Yeah. And yeah. I said most of it. We're doing pretty good here. Yeah. Yeah. You know, and so in essence, what I'm saying, and I hope that this is clear, that right, this healing thing that we're doing is essentially we're trying to get back to this version of each of us, right? It really is that simple. Meaning, I think we've all learned stories of shutdown, of quieting ourselves, of not being ourselves, of not speaking the way we want to speak, right? So to me, that is the essence of healing, right? Is having the freedom again, right, to be. And so if I think anything, if I taught, or actually if anything comes to mind for you guys that helps you understand healing, that you feel connected to today, I would say it's not because I was teaching you anything, okay? But I like to think of it as I was reminding you of your essence of being human. Because I think to me that's what these medicines do, right? That they're just reminding me of my humanness. And actually, I like to play with words a little bit. So psychedelic-assisted therapy is like every psychedelic. I like to think of it as psychedelic-assisted humanity is the way I like to approach it, because I think that is hopefully, you know, what in the years and decades to come is really what we see, because we really need it, right? For the environment, for the violence, all these things. And yeah. I think the last thing I'll just say is, you know, back to this thing about sagas, is that really how precious each of you are, okay? Really how precious. There was a moment where I realized that the potential that each of us have of expressing ourselves, of living really living and creating what we want in the world, you know, it's a unique opportunity, yeah, that one that you can only express that way, you know, of the 8 billion plus people that's on this world, right? It's such a precious opportunity to write a story, okay? And unique to any human that's ever walked this earth, that will ever walk this earth, okay? And you are the sole author of that saga for yourself, okay? And just believe in yourself, make the most of it, maybe try psychedelics, and I think that's all I've got for you today.
I just want to thank you so much for your talk. And I just wanted to make an observation, and that is something that I share in your experience, that I had to reach a real place of desperation to
Who's talking? Sorry.
Over here. To finally come back to psychedelics. I'd done some in my youth. And I want to make that observation that me as a therapist, and for many of the therapists in the room, where we're at in the field right now is that we see people coming to psychedelics in their deepest moments of pain and feeling so desperate for that relief. And maybe it won't always be that way. Maybe the field is moving forward to something different. But right now, I just wanted to take a moment to acknowledge that. And having had sessions with so many people who've had deep psychedelic experiences, what it took to get them there, and the maybe perhaps very long period of unnecessary suffering. That's it. I just wanted to put that in the room and to thank you.
Yeah, your comment reminds me about something which is again this psychedelic assisted humanity, and reminds me about something that one set of things I like to think about, which is, and Rick's not here, is he? I've known the guy for 10 years. He's like seriously like a father to me. He's never made it to one of my talks. I was telling you. I like to think of it because we have so much love that he's like, oh, Will won't mind if I sleep, because he needs his sleep. But I only mention him because, yeah, I mean, we used to hang out. Like, you know, he was like at one point my only friend in Boston, and like I would call him, we would text, he'd be like, come over, smoke some pot. He taught me how to smoke pot. He's very proud of that fact. And but I mention Rick because, you know, he has been and is still the person, my most trusted human being. You know, the number of times I've called him suicidal are many. And, you know, and even once during 2020, once he started getting even busier, like I was feeling so suicidal that I called him. And then we had this very long conversation. He asked me about what was going on and all these things. And then I felt a lot better. I cried. And, you know, the importance is, I feel like what I'm saying is allowing, can we be these vessels that people come to and that can feel, right? Like we don't have to try to change something. And therapists, and that's the thing, I think as therapists and doctors, like it's hard. Like I've felt myself, I'm in this position, people come to me, but sometimes I've martyred myself or felt like I have to change something. Where I realize the power of just being with people. And I'm not talking about clients. If we don't have room for clients, we don't have room for clients. But the reason why I really like to think about this concept of psychedelic-assisted humanity, right? This openness to emotion for ourselves and other people. Like psychedelics don't require that, right? I like to say psychedelics are neither sufficient nor necessary for healing, okay? But when combined with an empathic witness, they're the most powerful tool we have. Okay, but truly not sufficient, not necessary, okay? And the reason I mentioned Rick is because at the end of that conversation, I was just crying and I felt way better, but I'm like, I'm so sorry, Rick, I know you're so busy, everyone's blowing up your phone, and you've got so many emails, and he's like, No, Will. And I remember the way he said it till this day. It like brings me to tears almost. He's like, I want you to call me when you're feeling this way. I want to know when you're feeling like this. And and I bring that up because, again, there's a lot, I think, happening in the US I get these emails too, like, can I do, I'm so desperate, I need to do a session with you, when is this going to be legal? But I think at some point, again, it's important to honor the suffering, but that also reflects, people asking that they need the psychedelic reflects need a change in the way we look at mental health, because we can hold this, we can express this, and this, to me, this real empathy, right? That can go viral quickly, right? That can spread much more quickly than psychedelic medicines being legalized, in which company's going to charge how much, and like let's not get lost in that, right? Like it's the humanness that is scalable, right? The humanness is not going to take away from anybody else. Okay, so yeah, that's what comes to mind.
Hi, I just wanted to say thank you, because I came in here in a very kind of vulnerable mood this morning, and what you just did let me be okay with that, and that's hugely important for me. Thank you.
Thank you for sharing that. I really appreciate it. And I just wanted to make one more comment that came to mind, which is something I often share also, is that 99% of the healing, the way I work as a healer with my patients, I did not learn at UCLA or at Oxford or at Harvard, truly. And if anything, a lot of that training got me further from being an empathic healer. Okay, and so that's just something very important to say, because I think often when I'm invited to be on a stage or something, it's because of the degrees I have. So I don't want to trick that into saying, oh, I learned these things there. No, that again, this humanness we all have in all of us. It's just again, these medicines are reminding us of it.
Hello. Hello, Willie. Do we call you Willie?
Yeah, we can.
Is that what you prefer to be called?
My mother and my girlfriend call me Willie.
How do you prefer to be called?
Well, we can. What's that?
How do you prefer to be called?
Will is fine.
Will. It's so lovely to meet you.
Ah, great.
And I feel more comfortable speaking to you. You talked about in your early childhood about your hyperactivity, and that really resonated with me. Have you ever had a clinical diagnosis of ADHD, and how has that affected you? Because I feel that many of us who have been diagnosed or undiagnosed with ADHD are people who maybe connect more with their authenticity. They are capable of maybe speaking more of their truth and having more emotion than thought. Can you comment on that? Thank you.
Yeah. So I've come to believe that all of the only DSM psychiatric diagnoses that I'm a bit unsure of, but I still leave it open to perhaps not being curable. So every other DSM diagnosis except for the pocket that's in the schizophrenia, I think will be curable with psychedelics, okay? Meaning, I believe that most of what we've done in terms of creating categories of diagnoses, right? Generalized anxiety disorder, OCD, PTSD, ADHD, are mostly simply coping strategies of the suppression of emotion, right? I feel like energetic suppression, emotional suppression, you know, again, of pain, of sadness, of loneliness that we get in our culture and our family has to come out somewhere. It has to come out as an energy somewhere. And so for some people that ends up being, again, OCD type behaviors. For some people that tends to be fear type behaviors. For some people that energy, because sometimes if you're made to be still, goes to the mind, and you have to think. And we're such a thinking culture anyway, that I think the majority of what we call ADHD is not a biological defect or something. It's held anxiety, but it's also, again, misdiagnosis and just an attempt to cope with these unreleased energies. The clock's saying 0. I know we had said till 12, but I don't know what you guys want. One more question? Okay. And I also don't want to forget. Sorry, I forget to I'm really bad at marketing myself. So I've been working with Goop with this is Gwyneth Paltrow's company. She's a good friend of mine. We put out this episode yesterday, actually. So this is just released on Audible. It's a project I worked on with Rick and Gabor Mate. So I'm in conversation with the both of them. Gabor has also played a role of a great mentor to me and teacher over the years. And so this will be a little bit more about my story and healing and stuff. So if you guys want to check it out, I think it's actually free on Audible too. I don't think you have to pay for it. So that was just a cool synchronicity that came out during the conference for me. It's been like a year in the works.
Hi, Will. Just a quick question for you. First, I want to say thank you, and I admire your strength, genuinely, and I can feel a tremendous amount of love in this room for you, so really thank you. I wanted to ask you more about, you described the experience of chasing, and the next degree, and then being the top, and then how that all kind of dissolved, and your current perspective, and I'm really curious about learning more about that transformation and how that all occurred.
Well, I don't think that I said it resolved. Because it hasn't. All of these old sentences in my story, right, in my ultimate book, in my saga, they've gotten quieter, right? Saying that I don't have the right to speak, or that I'm less than, or that I still have to achieve. Those voices are quieter, but they're still there, right? Even leading up to this talk and the week before, even as I sat here. Those voices are there, of are you doing the right thing? Do people, care about what you are doing? Do you matter? The voices are still there, and even the one of continuing to achieve, but it's quieter. So, So I deal with them by, working with my therapist, working with psychedelics, and for me, actually, feeling that they won't go away and actually not wanting them to go away, seeing that they're a part of me, that they have given me gifts of certain types, people, and experiences, has brought a gentleness with some of these narratives, and I found that the less I try to push them away, they become even quieter because they feel like I'm not trying to get rid of them. So I would say that's the way I've dealt with those the best. Yeah. Okay, thanks everyone.